the alarming news of sweeping cuts to the U.S. Department of Health and Human Services, HHS, workforce, orchestrated by Secretary Robert F. Kennedy Jr., has ignited a firestorm of criticism and disbelief among health advocates nationwide. These cuts, presented as a streamlining of bureaucracy, have in reality gutted numerous vital maternal and child health programs, raising serious concerns about the future health of the nation's children. Kennedy's justification, a focus on reversing the chronic disease epidemic and realigning the organization with its core mission, rings hollow in the face of the devastating impact on critical services. The ambiguity surrounding the extent of these cuts is equally unsettling. Kennedy's own admission to reporters that we're going to do 80% cuts, but 20% of those are going to have to be reinstalled because we'll make mistakes, reveals a staggering lack of planning and a disregard for the consequences of these actions. This upheaval comes amidst a backdrop of simmering conservative criticism of public health agencies, particularly the Centers for Disease Control and Prevention, CDC, fueled by lingering resentment over pandemic policies. The Republican Party, deeply divided on this issue, harbors widespread skepticism regarding the value of federal public health initiatives, often citing grievances related to vaccine mandates. This antipathy extends to certain conservative states where programs have faced intense scrutiny, partly due to their investigation into preventable deaths potentially linked to restricted abortion access. The impact of these cuts is profoundly felt across numerous crucial programs. The CDC's Division of Reproductive Health, responsible for crucial maternal health research, has been effectively decimated, with a significant portion of its responsibilities reportedly absorbed by other agencies. The Pregnancy Risk Assessment Monitoring System, PRAMS, a gold standard maternal mortality survey, has been completely halted, with its entire staff placed on leave. This leaves a gaping hole in our understanding of maternal health risks and outcomes. Even a vital HRSA hotline providing mental health support to new mothers has been eliminated. The effects extend beyond maternal health. Federally funded Head Start programs, providing crucial childcare for low-income families, are facing significant disruptions due to layoffs at the Administration for Children and Families. The CDC's team of experts on infertility, a field affecting 1 in 6 people globally, has been completely disbanded, just days after former President Trump boasted about being the fertilization president. This leaves the country without crucial expertise to ensure compliance with existing laws regarding fertility clinic success rates. The ramifications for couples struggling with infertility are profound and deeply concerning. The National Center for HIV, Viral Hepatitis, STD, and Tuberculosis Prevention has also been severely impacted, with its director placed on administrative leave. This leaves a critical void in the fight against the spread of diseases like congenital syphilis, which is currently on the rise in the United States. The elimination of this center's expertise is a direct threat to public health. The cuts extend even to the National Institutes of Health, NIH, where the forced departure of numerous center heads, some reportedly offered reassignment to remote locations in the Indian Health Service, has sent shockwaves through the scientific community. The unprecedented scale of these reassignments underscores the depth of the restructuring and its potential to cripple vital research initiatives. Among those affected is Dr. Jean Marazzo, a leading expert in sexually transmitted infections and women's reproductive health, and Dr. Diana Bianchi, director of the Eunice Kennedy Shriver National Institute of Child Health and Human Development. Their loss represents an immeasurable blow to public health research and advocacy. The sheer breadth and depth of these cuts, coupled with the lack of transparency and apparent disregard for the consequences, paint a deeply troubling picture. The future health of the nation's children, particularly vulnerable populations, hangs precariously in the balance. The dismantling of these crucial programs represents not merely a reduction in bureaucratic sprawl, but a profound and potentially irreversible erosion of the nation's public health infrastructure. The long-term consequences are almost impossible to fully comprehend, but the immediate alarm is palpable and justified. These decisions demand immediate scrutiny and a thorough reconsideration of their potentially devastating impact on the well-being of Americans. The silence from those affected by these cuts speaks volumes. The lack of immediate responses and public outcry demands further investigation and a call for accountability. The implications stretch far beyond simple budget cuts. They are a direct assault on the health and well-being of millions. The true cost of these actions remains to be seen, but the initial signs are profoundly alarming.